All FMG aspirants who have started preparing for FMG exam. First of all, we need to know about the recent FMG exam which happened on 26 July 2025. After writing the exams, most of the students had different opinions. Some said कि sir exam was very difficult. Some said कि sir options were very confusing. All questions were okay. All questions were moderate. So basically we have got mixed reviews. Some said, sir, questions were very lengthy. All right. Remember, overall, what is the analysis? 100 questions were difficult and 200 questions were moderate. Most of the faculties will be saying same thing. In every exam, approximately 200 questions will always be doable, although questions were lengthy, options were confusing. What we have analyzed as per the years, this is the real graph of difficulty level of FMG exam. Once upon a time, they used to ask only one-liner questions. After that, they started adding image-based questions and they started integrating with clinical situation, clinical scenarios. Basically, this is the level of FMG exam right now. One-liners in a recent FMG exam, only few. So overall, we need to understand what examiners want from FMGs. First of all, subjective knowledge, yes, this is must of all 19 subjects. After that, you should have basics of clinical orientation. And yes, they expect basics of patient management and leadership quality. Okay, now I'm showing you one question which is now the normal pattern of FMG exam. A 45-year-old man presents to a clinic with complaints of weight loss, frequent urination, increased thirst and appetite. His father had similar symptoms who was on metformin for last 7 years. Now I'm sure you know that his father was suffering from diabetes mellitus. Now clinician wants to check his sugar level and lab technician has collected his blood sample in the given tube. The sample tube has one agent that ensures that further breakdown of glucose will not happen, so that accurate level of glucose can be estimated. Which of the following is a right statement related to this scenario? First of all, look at the tube. Which color tube is this? This is a gray color tube, which we are knowing from the hospital practice that this we are using to estimate sugar level. All right. But now when you read this question carefully, this question belongs to medicine also, clinical practice also, and biochemistry also. Simple example is that suppose if a lab technician is going to collect blood sample from here, if he will be using red color tube, which is actually plain tube, and after half an hour when he will be reaching his lab, by that time, see, glycolysis can happen. And after that, see, there can be the breakdown of glucose. And you know, after half an hour, you cannot estimate exact amount of sugar. So there should be some ingredients in this tube. That's why gray color tube is being used. One should be anti-clotting agent potassium oxalate and one should be anti-glycolytic agent, which you would have learned in biochemistry in glycolysis cycle, that enolase enzyme is being blocked by sodium fluoride, so that there should not be further conversion. Now, after reading all these options, I'm sure you can rule out what is the best answer as per your biochemistry knowledge, right? Here answer is C, and I'm sure now you can easily understand what is the level of FMG exam. Basically, remember here now old pattern of learning, rapid revision, golden points, one-liners gone. Please don't rely on those things. Rapid revision, no. 100% no. Only golden points, only one-liners, 100% no. So, what should be your strategy now? First of all, you are having 5.5 months in your hand. Okay, starting 3 months, you have to learn all these subjects in detail with the help of faculties. So in the first 90 days, you have to work on building the concept. Make your concept strong first of all. So first of all, learn. Then you have to understand the concept. and then you have to memorize, and then you have to practice MCQs. This is the basic norm now. After that, again, revise, right? And then memorize, and then you have to practice question. So minimum you have to revise for 4 times by the end of your 5 months. So what are the requirements to pass FMGE exam in 5 to 6 months? Read all 19 subjects, and there should be revision for 4 times. And every day you will be sitting in your classroom or library at least for 14 to 15 hours. Before you end your day, before you are going to your bed, please check yourself, reassess yourself. Did you do justice with your day or not? This is called a self-assessment on daily basis. Whatever plan you have made, did you accomplish or not? Or you have wasted a lot of your time. So you have to be careful. MCQ practice on daily basis. Don't keep a target that you have to solve 100 questions, 200 questions on daily basis. Remember here, even on daily basis, even if you are solving minimum 30 questions, it should be fine. But this should be on daily basis. It should be your habit. After that, you have to write 1 exam after completion of 1 subject. And then mini mock exam at the end of every month, and in total minimum 6 to 8 mock exams. This is the basic things which you have to do. Now, what are the mistakes of medical students? No proper revision. Suppose if you are learning a subject and if you are not revising it, then your work will be equal to 0. Lack of sleep due to overthinking, anxiety. Many of the students will be thinking in the same manner, what if I do not pass this time? What if I will be failed in this exam? Why are you thinking about result now? Please make a habit of making short-term plan only, right? What I am going to do tomorrow, plan your tomorrow. Make a short-term plan so that you can have better understanding about your plan. And after that, when you are going to complete your short-term plan, then short-term accomplishments, slowly, this will be building your big time and long-term achievement. Lagging behind the teacher space. So many students will be doing this kind of thing that after learning from a subject, they will be thinking that I can revise it with some other subject. Okay, physiology is going on, I can revise with anatomy. My dear friends, this should be the rule that if you are learning from a teacher, if you are sitting in the library, whatever a teacher has taught you today, revise on the same day. Because like in 5 months, you have to complete the courses of 5 years. You don't have that much time. So please don't do this. Because after 1 month or after 2 months, when so many subjects will be completed at your coaching centers and you will be feeling that you have completed only 2, 3, 4 subjects, then you will be having so much of frustration, so much of pressure you will be facing that time. And that can be dangerous for you. So please don't do this mistake. Lagging behind the teacher space, no. Same day you have to finish your revision. Skipping the mock exams after every subject. Please don't do this. Many students will stop writing the exam because they feel that when they write exam, when they do not score good, they feel depressed and they waste 1 or 2 days. My dear friends, you are not writing this exam to impress anyone. Exam is the part of your training. Writing exam is the part of your journey. If you write the exam, then only you understand your level. Then only you can understand your weak points and strong points. First time if you are writing exam and if you are scoring only 50%, this is completely fine. No problem at all. Revise again. Second time you can score more than 60%. This is also fine. Third time when you will be revising, no, then you can increase the score for more than 70%. After 4th time only, you can achieve up to 80 to 90% of score. This is normal. You need to understand this and you need to accept this. Jumping from one platform to another platform. Please stick to one. Read one topic 6 times from the same book rather than you are learning one topic from 6 books. This will be wasting your time. Please don't do this. Students' mindset, mugging up, one-liners, only revision, jumping to multiple platforms. Remember, your mentors will be telling you focus and understand the concept. There should be integrated and clinical approach. There should be question practice on daily basis, and you have to stay at one platform only. Same notes you have to revise again and again, again and again, again and again. And now, what is the normal FMG pattern? Now, more than 250 questions will be clinically integrated questions. Image-based questions will be approximately 10 to 20. One-liners or fact-based questions, we should be expecting very, very less. So now when this is the normal pattern, in the same manner, we have to start learning. We have to focus on understanding the concept. Now, what about the weightage of different subjects? As per the blueprint, there will be 17 questions from anatomy, 17 questions from biochemistry, and 17 questions from physiology. Microbiology, number of questions will be 13. Pharmacology, number of questions will be 13. And patho, number of questions will be 13. You can ask me, okay, sir, physiology 17 and pharmacology only 13. So pharma, they are asking more than 20. No, yes, pharmacology will be more than 20, but integrated with medicine, integrated with surgery. Microbiology will be more than 16, 17, 18, integrated with medicine and surgery. In the same manner, pathology will be more than 20, integrated with medicine. Number of questions from medicine will be minimum 30, surgery 30, obs gynae 30, and PSM 30. Ophthalmology 15 to 20, and pediatrics 15, ENT 15. Psychiatry, number of questions will be 5. Radiology, number of questions will be 10. Orthopedics 5, anesthesia 5. Forensic, number of questions will be 10, and skin, number of questions will be 5. See, this is as per blueprint. Psychiatry, every time they are asking 8 to 9 questions, but approximately 3 to 4 questions will be related to psychopharma. Radiology will be more than 20. Radiology is everywhere, in orthopedics also, surgery also, obs gynae, CT scan, MRI, ultrasound will be everywhere, right? Even forensic, approximately 10 to 12. Derma, number of questions can be 7 or 8, integrated with medicine and some other infections, right? But out of these 19 subjects, which subjects are most important? Remember, these 4 subjects will always be the game changers. As per blueprint, only 30, 30, 30. But sometimes, from surgery, they can ask you more than 40 or 45. Sometimes from PSM, they can ask you more than 40 or 45. Obs gynae, this time actually on 26 July 2025, obs gynae were there more than 45 or 50 questions. Medicine will always be the biggest subjects. So these 4 subjects will always be the most important. Recently, they have asked many questions from ophthalmology, more than 25. And ENT and pediatrics, yes, these number of questions are being increased in these subjects. You see, yeah, this is the basic ideas about these different subjects. Remember here, if you are not completing anatomy, you will not be able to understand surgery well. You cannot perform well in surgical branch like ENT also, obs gynae and surgery. If you are not good in physiology and pathology and pharmacology, you will not be doing great in medicine. So basically what I'm trying to say here, that all 19 subjects are important because our questions will be clinically integrated. Now, you should be very much careful that if I ask you to be disciplined for 1 day, easy to practice. If I ask you to be disciplined for 1 week, easy to practice. But I'm asking you to be disciplined for 5.5 months, next 5 to 6 months. This is actually a difficult part. You have to be very disciplined. So you have to divide your time accordingly. I gave a strategy of 15 plus 9 hours. In 9 hours, 6 to 7 hours you have to sleep, and 2 hours you have to keep for miscellaneous activities like food, tea, coffee, phone calls and all. But remaining 15 hours, my dear friends, every day on daily basis, you have to give only to the study part. Remember, 8 to 9 hours you will be having classes, at your institute. Same topics, whatever your teacher has taught you, you can revise in 4 hours. If you study alone, this will give you pseudo confidence. So make a habit of doing group discussion. Make a small circle, a small group of students, where every day on daily basis in the evening time you can have discussion. Close your books and after that ask the question to your friend, to your study partner. So 1 hour you have to give for group discussion. Remember, if you study alone, this will give you short-term memory, but when you discuss it, no, your short-term memory will be converted into long-term memory. 1 hour every day, minimum 30 questions, and you have to spend for rectifying your mistakes also. Suppose if psychiatry subject is completed, now you are learning radiology. With radiology, you need to revise psychiatry also, or the subject which you have completed. So keep at least 45 minutes to 1 hour for the revision of all subjects which you already have completed. Why it is important? Because if you are going to leave any subject for 1 month, no, after that if you are going to open the book, this will become 100% new for you. Okay, so when you are revising only for 1 hour, no, you have to revise only golden points, only, all those points which you would have highlighted. All right, so in this manner, if you are going to divide your time, I'm sure there will be very, very good result. Remember here, make a habit of sticky notes also. Every day, whatever you are learning, what are the most important points your teachers have asked you, you highlight this, make a circle here. Yes, on these sticky notes you can write and you can paste on the wall, right? So that every time you can sharpen your memory well. Remember here, simple thing is that in 5 months you have to complete the courses of 5 years. Always keep in mind, winners don't do different things. They do things differently. You have to be smart and you have to be the most hardworking person in the room. I wish you all the best. Thank you so much.